I'm going to talk to you about four kind of famous diseases. The first one is the African sleeping disease. What it is? Well, it is an insect-borne parasite infection of humans and other animals, and it is caused by microscopic parasites of the species Trypanosoma brucei. It is passed from person to person by the blood-sucking tsetse fly, that is a robust, sparsely bristled insect, which is only found in Africa. The trypanosoma grows and divides in the insect's intestine, and then it migrates to the salivary glands. And when the fly bites a person, the protozoa may enter the victim's bloodstream, where it reproduces. After the protozoa may has been in the blood, it may invade the central nervous system and causes inflammation of the brain, resulting in weakness, mental lethargy, and sleepiness that can lead to a coma and possibly death. The second disease I'm going to talk about is dysentery, which is an infection in your intestines that causes bloody diarrhea. It can be caused by a parasite or bacteria, but the type you have depends on what caused your infection. Dysentery is the most common type of dysentery. It results from bacteria called Shigella. The disease is called shigellosis. About 500,000 people in the U.S. get it every year. Another type of dysentery is the amoebic dysentery that comes from a parasite called Entamoeba histolytica. You are more likely to get this kind of dysentery if you have traveled to a tropical location that doesn't have good sanitation. You can get dysentery if you eat food that's been prepared by someone who has it. For example, you might get it if the person who made your food is sick and didn't properly wash their hands. Or you can get dysentery if you touch something that has the parasite or bacteria in it, such as a toilet handle or sink knob. You can sometimes carry the bug that causes dysentery for weeks or even years without knowing it, and you can still pass the infection to other people even if you don't have symptoms. The symptoms can show 1 or 3 days after you get infected. In some people, the symptoms take longer to appear. Other persons actually never get symptoms. Each type of dysentery has slightly different symptoms. Bacillary dysentery causes diarrhea with belly cramps, fever, nausea, and vomiting, and blood or mucus in the diarrhea. The disease I'm going to talk about is a very known disease, a kind of famous, that is called malaria, and it is a devastating disease of the tropics that is caused by Plasmodium, that is a gene. It is probably the best known representative of this phylum. This disease is transmitted from one person to another by the female Anopheles mosquito. These mosquitoes become infected by ingesting the blood of a human who has malaria. The Plasmodium cells mature and develop in the mosquito and migrates to the insect's salivary glands. Before feeding on the blood or another human, the infected mosquito injects saliva into the punctured wound of its new victim and thereby puts the parasite back in the human bloodstream. The illness may cause fatigue, thirst, and high fever, alternating chills, and more other. Malaria can be treated. If the right drugs are used, people who have malaria can be cured and all the malaria parasites can be cleared from their body. However, the disease can continue if it is not treated or if it is treated with the wrong drug. Some drugs are not effective because the parasite is resistant to them. Thanks. Last disease I'm going to talk about is also a very known disease that is called syphilis. It is highly a contagious disease that's mostly spread through sexual activity. It is caused by the bacterial Spirochete treponema pallidum. You can get it through direct contact with a syphilis source on someone else's body. This usually happens during sexual activity, but the bacteria can also get into your body through your cuts on your skin or through your mucous membranes. This disease starts as a painless sore, typically in your genitals, rectum, or mouth. Syphilis develops in stages, and symptoms vary with every stage, but the stages may overlap, and symptoms don't always occur in the same order. You may be infected with syphilis and not even notice any symptoms for years. The first sign of syphilis is a small sore called a chancre. While most people infected with syphilis develop only one chancre, some people develop several of them. Many people who have syphilis don't notice the chancre because it's usually painless, and it may be hidden within the vagina or rectum. Within a few weeks of the general chancre healing, you may experience a rash that begins on your throat but eventually covers your entire body, even the palms of your hands and the soles of your feet. This rash is usually not itchy and may be accompanied by white-like sores in your mouth or genital area. Some people also experience hair loss, muscle aches, a fever, and a sore throat and swollen lymph nodes. And yes, syphilis can be cured with the right antibiotics from your health care provider. However, treatment might not undo any damage that the infection has already done. Thanks.